our monoclonal antibody infusion centers that we had located at 5 of our hospitals: McLeod Regional, McLeod Health Seacoast, Loris, Clarendon, and Sherrill.
And those were all going full tilt
at different times during the pandemic. They were. We started initially just with McLeod Regional Medical Center, and within probably 2 weeks after piloting in Florence, we expanded to Seacoast and Clarendon because those were 2 of the hot spots in the state at the time that we began the treatments back in November of 2020. Over time, as the pandemic would decrease and then surge again, we would open up additional facilities or start limiting our services based on the volume and the need in response to the community cases.
How good did you all get at predicting which centers would need to up their game and which centers could, give their staff some rest?
We got pretty good at it by the 3rd surge, but the thing that we couldn't really predict was what was going to happen with the drug supply. That was really one of our big rate limiting factors, because the way that the medication was allocated, it's given from the federal government to the local state levels, and then the state divides it out to the hospitals based on their capacity to intake patients, and then also by their case rates. And so during times of shortage with the medications, like within this last surge where we only had one product that would actually treat this variant, it was very difficult to get enough medication to be able to treat all of the patients who were infected and who were eligible for the treatment.
So your supply was always just a little bit behind your demand.
Absolutely.
Had to show demand before they would send supply.
That's right. So that's one of the interesting things about the allocation methodology, is that you had to show that you had treated a certain number of patients to continue to be able to be eligible and to get more product. And so that was probably one of the things that we've learned, as a state and as a whole, is that the methodology sometimes needs to shift in response to times of extreme surges with shortage of product.